Welcome back. We're still listening to news and views right here on Salam Media. The time is 5 minutes till the top of the hour 9, and we're going to be bringing you a deeply concerning story that is emerging from one of Gauteng's flagship health facilities, the Charlotte Maxeke Johannesburg Academic Hospital. Patients there have been left hungry and distressed after lunchtime meals suddenly disappeared from the hospital's menu. Reports surfaced after DA Gauteng Shadow Health MEC, Dr. Jack Blom, conducted a visit following complaints from families and staff, and what he found was alarming. Instead of full nutritious meals for people that are obviously sick. Patients were reportedly receiving nothing more than a single slice of bread with margarine and cheese, a completely inadequate meal for people recovering from surgery, chronic illness, or any kind of trauma. And we'll try to find out what the crisis stems from. Where does this abrupt shutdown of Charlotte Matlake's food supply stems from, and the implications of it. And will now be joined by Gauteng Shadow Health MEC, Jack Blom, who visited the hospital and has a bit more insight on what's really happening on the ground and why we find ourselves where we currently are. Mr. Blom, thank you so much for joining us. Welcome to News and Views. I really appreciate you giving us the time this morning.
Good morning. Good to be with you.
I think let's jump right into it. Why is there no food at Charlotte Maxeke at this current moment? What happened? What led us to this point?
Well, look, they get their lunch meals from a provincially run cook freeze facility. It's called Maxeke. It's actually in Pretoria, and it's been closed down for 2 weeks now because the Tshwane municipality sent inspectors there, and they found, can you believe it, E.coli. E.coli. This comes from feces. So
Mm,
obviously, it's unheard of for a foods facility to be so unhygienic. So they closed down the Masakani cook freeze facility, and this facility serves 6 hospitals as well as a large number of community health centers. It's not just Sharpenkleke Johannesburg Hospital, includes Lenasia South Hospital actually as well, and several hospitals in the Pretoria area. So normally they get a cook freeze meal. This is a plated meal with it would be meat, vegetables, starch. A proper meal, a nutritious meal that you'd need if you're recovering in a hospital. And it's been shut off for 2 weeks now. So Maxeke Johannesburg Hospital, I received complaints. I went there to see what the problem. They said, well, it's serious because patients are complaining, so relatives are bringing in food, and the hospital's able to cope with breakfast and supper, but all they could provide, and I saw it for myself, was, quite frankly, a pathetic piece of bread with a little bit of margarine and cheese, completely inadequate. Really most unfortunate, I think.
mm, mm, mm. From what you observed, how is this, shortage impacting vulnerable patients, especially, the elderly, those that are post-operative patients, and most concerning, I think, those without family support, because at least others, do have families that can bring them those meals to make sure that, they recoup and recover well. But, we know the story. There are other patients who maybe are neglected. They don't have families. There are also young children who are at the hospital. How are they affected by this, and are they mitigating factors now that we know about this?
Well, as I said, the shutdown was 2 weeks ago. I visited the hospital last week. Now I hear that they're scrambling around trying to get alternate meals, and I heard that Sharmeka Johannesburg Hospital was getting food from Helen Joseph Hospital. I mean, the problem is we've had so many problems with food contracts to our public hospitals over the years. There was a period when Chris Hani Baragwanath Hospital didn't have bread. Can you believe that? So easy to get bread. I think, frankly, there's corruption with the food contracts. They're frequently disrupted. And of
Mm,
course, you need fresh food as well. And they've got 2 contracts that they're using from other provinces, Free State and Limpopo. Now, I have to ask, Why are we getting food from other provinces instead of a decent, reliable supply from Gauteng? But in this instance, it was the disruption from a provincially run food facility, Maxeke cook freeze facility. But just think about it. This is a food
Mm,
facility. Can you imagine they found E.coli? So had the patients eaten uh, this food from Maxeke, I mean, it would have poisoned them. Imagine being in a hospital, you're already sick and vulnerable, and then you eat poisoned food. So it just shows you unbelievably poor management, negligence, and in fact, the department has been completely silent about it. They only sort of issued a statement yesterday confirming that Maxeke has been shut down because I raised the alarm. So, I mean, there's been very poor communication about it. They didn't have contingency plans. And meanwhile, hospitals are doing the best they can, and of course, relatives are bringing in food. Uh, but think about it again. A food handling facility has got E. coli in it. That should be
mm,
completely unheard of. That something like that could happen, and we don't have a timeline again when it's going to be reopened. But quite frankly, I think there needs to be heavy disciplinary action, and we need to see real action.
And I want to focus on Masakane itself. You know, you mentioned that it supplies thousands and thousands of meals daily across multiple hospitals and in other provinces as well. Doesn't this reveal a deeper, say, structural weakness in how things reliance on a single centralized food system?
Well, normally provide 8,000 plated meals, and now the hospitals and clinics that need them have to find it from somewhere else. Look, I question why we need to have a provincially run food facility in the first place. I mean, it's something you could easily do on contract or outsource it. We're in Gauteng. We have we have lots of readily available, high quality, cost competitive food supplies. So
Mm,
why is the province running a very dysfunctional, uh, you know, badly run, unhygienic, as we found out, cook freeze factory in Chwani? Now, you must ask yourself, why does the Nasia District Hospital have to get their plated meals from provincially run facility in Pretoria? I mean, just think of the
mm,
distance involved. So I think there is corruption, quite frankly, massive mismanagement. That's what we've come to expect, unfortunately, the Gauteng Health Department. But, food should not be a problem in our Gauteng public hospitals. It's readily available from numerous high quality, cost effective suppliers. We've had bread shortages. And why we have to get suspicious contractors from Free State, Limpopo, and they're overpriced as well. Some of them, they don't even produce food themselves. I think it's all a scam. I mean, it reminds me of the Tembisa hospital corruption, because some of these, I track these companies. There's a Free State company. It's not even a food company. Yet somehow they're supplying groceries to Gauteng hospitals. So the food contract situation is completely unacceptable. We have periodic crises, and if they can't fix this Maxeke cook freeze factory and get it working, I don't see why it should actually continue, because machineries continue breaking down there, and at the end of the day, we must think of the patients. Patients need reliable, nutritious food, and they not always getting it in Gauteng public hospitals.
I want to just focus just a bit broadly on the health system concerns here in Gauteng. Maxeke is one of the province and South Africa's most important academic hospitals. What does this incident tell us about the broader state of infrastructure and management in Gauteng healthcare? I'm just thinking about this because there was an oversight report that was released a few days ago that showed that several Gauteng hospitals still remain fire risks despite years of warnings. And we saw, the fires that happened, for instance, in Tembisa Hospital. just generally looking at the province and the state of healthcare, what would a proper analysis for that look like?
Well, if we to use a medical analogy, it's in intensive care and it needs emergency action. But look, the head of the Gauteng Health Department was recently suspended by the Premier because he failed his lifestyle audit. Now, he should never have been appointed in the first place. I mean, I pointed this out several times to the Premier who defended him. He was appointed last year in June. Mr. Lesiba Malatana, despite being investigated by the SIU, ironically, for allegedly receiving a bribe along with two other officials, a 10 million rand bribe, allegedly, concerning containers, plastic containers for, yes, the Maxeke cook freeze facility. So, in fact, the suspended head of department, of the whole head of the whole Gauteng Health Department, in fact, has been facing investigation for years now for, suspected corruption to deal with containers for this very same Maxeke cook freeze facility. So, he should never have been appointed in the first place. The Premier's now been forced to suspend him. We now have an acting head of department. We don't have a permanent chief financial officer. We haven't had one for several years now. The department is rampant corruption. Is full of corruption at every level, and I don't see the political willingness to fix it up. So we saw what happened at one hospital alone, Tembisa Hospital, 2 billion rand, more than 2 billion rand stolen from one hospital. Tembisa Hospital is a mid-sized hospital. Maxeke, Johannesburg Hospital is sort of twice the size, twice the budget. And we can't get it right. We don't appoint the right CEOs. You've got to put good people at all levels. So we have crises at manifold levels. So the issue with fire risks is that virtually all our Gauteng hospitals do not do well on fire compliance. They don't meet fire suppression and fire detection systems. And it's of great concern. But of course, we have crumbling facilities, we have budgets that are not properly spent. It's a crisis mode, and we need new leadership at all levels at the Gauteng Health Department and clear out the rot. But I don't really see it at this moment because I think there's too many people who are politically protected.
And I think that's the most unfortunate part. Mr. Blom, thank you so much for joining us. Really, really appreciate you giving us your time and giving us insight on this very, very concerning turn of events. Thank you so much.
Thank you.
That was Jack Bloem, DA Gauteng, Shadow Minister of Health. Giving us light on a very, very deeply troubling situation for patients at Charlotte Maxeke Hospital, patients that are already battling illness and now are having to go hungry. And, I understand the fact that other patients have family members who, can bring them food at the hospital, for the occasional visit. I'm just thinking to myself, well, what about those that don't have families? If people that are just by themselves went in for an operation, maybe the family is in another province. We know a lot of people that stay in Gauteng. They are immigrants, we are economic immigrants coming from other provinces, other parts of the African continent, and not everyone has immediate family close by here in the province. And if you have a family member who's currently at Charlotte Maxeke, you can give us a call. You can let us know what the conditions are like. What are they telling you? Our studio line is 011-680-0355, or you can send us a WhatsApp voice note or a message on 061-766-0355. Did you have to go to the hospital with prepared meals? Are they telling you that they're not eating, they're not being fed, they're not being sustained? You can let us know. I think this needs to be amplified as much as possible. We are getting some WhatsApp interaction. One of our listeners here says Jack Bloem is complaining, but the DA is part of the GNU. Instead of complaining, he should do something to assist, not moan and groan. Please ask him. And while he's still there, no use pointing a finger at government. He is part of government. And I think that's a valid question. But it's a bit misdirected, because this is a provincial issue, and he's only a shadow minister. So shadow ministers of well, not shadow ministers, shadow MECs of portfolios in the province don't really have that much power. So the GNU is not provincial per se. The DA and the ANC are not in a government of unity at provincial level. So I think that conversation can start maybe when we go to a national level where the DA, yes, is indeed government, but the coalition in Gauteng, or the leadership in Gauteng, doesn't consist of the Democratic Alliance. So they are still in opposition benches. So not government per se. But yeah, you're right. He can still raise it up. It does have the proper platforms. The party is, part of the Gauteng legislature. So it does have the powers. It does have the influence. Going to leave it there for now, but don't forget to engage with us. Our studio line again is 0116800355, on WhatsApp 061 766 0355. If you have a parent or child or family member who's at the Maxeke hospital, how have they been? How are they dealing with these crises? How did you have to come in and assist? Are you bringing in food? Are you bringing in water? Are you bringing in refreshments? What are they telling you about the conditions of the hospital and how they are treated? I think it'll be a really, really interesting conversation, and a bit insight into the lived experiences of those that are, I think, bearing the brunt of mismanagement, essentially, and no willingness from those that are in power to render proper services, to give proper service. Imagine E.coli found at a food production warehouse that produces food, readily made meals for a hospital. E. coli is found in human waste, people, and the dangers of ingesting that. One can only imagine if there was no inspection, and the food ultimately found its way to Maxeke and the 8 other hospitals that this Maxeke institution is delivering food to. What would have happened? It would have been another big incident of something like the listeria incident that we saw a few years ago with the polony. Remember that? People just started dying because there was not foresight. So, yeah, really concerning state of affairs. And these are people that are already weak. These are people that are vulnerable already. They are in hospitals. So imagine your immune system is already compromised. And yeah, don't even want to think about it. We're going to take a quick break. News and views will continue right after this.